Can you hear the people in the other room?
Hello, good morning, everyone, and happy Monday. Welcome back to another episode of Wake Up with YPN, where we help to kick off your week with some information that may be helpful for you and your business. I'm Kayla Fisher, your 2024 chair of YPN, and today we are excited to have Laura and Alan with us from the Patton Insurance Benefits. Now, you may know that enrollment is now open for health insurance coverage, and as realtors, most of us are independent contractors, so we do not get insurance coverage from our employers because we are self-employed, so we have to provide that for ourselves. And Laura and Alan work closely with the Iowa REALTORS Association, and we're excited to have them here today. Good morning, Laura and Alan.
Morning.
Thank you so much for joining us. Health insurance is an exciting topic that I'm sure you're ready to fill us in about, and it is that time of year. So will you tell us a little bit about what each of you do and what your roles are?
Well, we're a small family health insurance agency. It's myself, my son Alan, my other son Lee, and his wife, and Kristen, who's been with us for 17 years, and my husband, who passed away about 4 years ago. So we all work with group insurance. Alan and I work with the healthcare marketplace and individuals under 65. Lee and I work with Medicare as well. So pretty diversified as far as all health insurance is combined. Alan is going to kind of, you had some questions about group insurance options.
Yeah.
So I'm going to have Alan start with that.
Perfect. That sounds great. We can just hop right into it. So as members of the state association, our ICAAR members have access to some pretty good packages through you. And so I was looking through those enrollment benefits. So we could start kind of walking through those, starting off with the group health insurance. Alan?
Yeah. So on the group side, we currently have two main carriers that we write with. Walmart Blue Cross Blue Shield. The one downside is you do have to be a W-2 of an LLC. So you'd have to create that LLC and start paying yourself as a W-2 member. Or we have medical associates in your guys' area where they do write 1099 contractors or LLC W-2s. We also have United Healthcare, Allstate, and Optimal Benefits, but you would have to be a W-2 employee and have somebody else besides a spouse as the W-2 employee. So a receptionist, another salesperson, or kind of any other employee.
Okay.
And those are all group plans that you can start anytime throughout the year. There is no open enrollment on those. We can start those March, April, May. You can kind of enroll those whenever you get your business up and running or that W-2 started.
Okay, that's good to know because I know that there's that time period. Can you talk a little bit about what open enrollment is, like what that would involve and why that's important?
So, well, with the open enrollment being so important is, that narrows that window down of when you can apply. But on the group side, it's a yearly open enrollment. So yeah,
Okay.
we don't have to have a certain time frame. As long as you want a June 1st effective date, we need that paperwork in by the 15th of that month, the month before. So that's
Perfect.
kind of that only open enrollment period for those group sides.
Okay. And then individual health insurance for under 65.
So yeah, and that's right now. We have until December 15th for a January 1st effective date on that open enrollment, or January 15th for a February 1st effective date. This is really good for a lot of realtors because it's income based. We never know what the income is, so I know it's a little hard to kind of figure out what that income's going to be. But the nice thing is we can update incomes throughout the year. So, say you're going through the year and you're like, man, it's not going as well. We can decrease the income to give you more tax subsidies to decrease your premium. Or if you get a really good house and you're like, oh man, this is going to be a great year, we can adjust your income higher so that you don't have to pay any penalties on your taxes with reimbursing those subsidies at the end of the year. Right now we have Wellmark, Oscar, Medica, and now in your guys' area, Am Better just came to market in the Iowa City area. So we have a lot of good carriers to pick
Mhm.
from, and we can kind of customize those plans to somebody that needs better prescription care, better ER coverage. We can kind of tweak those with each carrier on what your needs are.
And the nice thing too is why they have an open enrollment period is because there's no health questions, there's no waiting periods, there's no riders on pre-existing conditions. So that's why people can only apply during the open enrollment um, period that Alan was telling you about, or if they lose insurance during the year, if you're on your spouse's insurance and they change jobs or reduce their hours and you're losing insurance, or your COBRA runs out, then you have a special enrollment period that you have 60 days from the date that you lose similar coverage to apply at a later date as well.
Yeah, thank you for adding that in, Laura, because I think some of us don't understand why that period is important and kind of how the insurance world works, because once we get something set up, we just kind of forget about it and hope we don't need to deal with it. But you are the expert, so please thank you for breaking that down and helping us understand why we're getting lots of reminders about open enrollment and why it's important for us. And then the next section that I kind of saw when I was scrolling was the Medicare and over 60 options. And I think, Laura, you mentioned that's your specialty.
Yes, it's another open enrollment period on Part D drug plans. So someone on Medicare has kind of two options. They can go a traditional Medicare supplement where you pay a premium up front, and then you have really good coverage when you go in the hospital or the doctors, and then you need a separate drug card. And during open enrollment, it runs until December 7th on the drug card for Medicare. And again, there's no health questions. You just need to look up your medications, or you give us your medications and we look them up, is what we do. And then tell you what the best plan for next year will be when you take the premium plus your cost of medications. What's going to be your total cost for the year? This year, or I should say next year, 2025, it's getting shook up a little bit because they lowered the out-of-pocket that someone can spend on covered medications down to $2,000, which is a good thing if someone's on a lot of expensive medications. But we're seeing that some people might owe that $2,000 in January, and for some people that can be a hardship. So they had to create a prescription payment plan to help those people make monthly payments instead of getting hit with $2,000. And if someone is on Medicare, they may want to check their plan because they're reducing the amount that people have to pay. Some of the plans are going away. Some plans are getting rolled over. Like one plan was $5.30. Next year will be $40. So you want to, if you're on a drug card, you want to take a look at that or have someone take a look at that before December 7th. It's also open enrollment for Medicare Advantage. So with the supplement, you pay up front with a premium. With the Medicare Advantage, a lot of them have no premium, but then you have copays when you use it. Like copays, $40 copayment to see a specialist, for $350 a day when you go into the hospital. That's also open enrollment for those Medicare Advantage plans. Those are getting shook up a little bit because Mercy Hospital is in negotiations with Aetna right now, and so their contract ends at the end of December. And Humana Medicare Advantage actually recently lost Mercy system in their network. So if someone's on a Medicare Advantage plan and likes Mercy, they might want to double check, make sure that they're still going to be covered next year. People do have, actually, the open enrollment is December 7th, but if you find out that your plan, maybe your doctor's no longer participating, you can actually change plans until March 31st. It's not something that can be advertised on TV. It would be too confusing for people, but you have kind of a leeway there where you can apply until March 31st on that. So
That's helpful to know too, that if we have any questions, there's a lot of confusing information. I know you have it all straight, but as someone who is in the realtor side of things, it is confusing, especially with all the other options and all the things. So thank you for helping to try to make this be as English as possible for us, and digestible. So that's kind of the health insurance coverage. Now switching gears a little bit towards dental and vision. Can you tell me a little bit about what those packages might look like for someone who's interested?
Sure, we do have actually a group plan that we've had for years with Delta Dental that's set up for the Iowa Association of Realtors. The nice thing is it is a group plan, so it doesn't have any waiting periods on, like if you go with an individual policy, you usually have to wait a year before you can have a crown or a root canal or any of those fun stuff. This is an actual group plan so that it doesn't have those waiting periods, and it's a lot less expensive than when you compare it to like Delta Dental's individual plan. For example, one of the best plans, one of the popular plans, pays up to $2,000 a year. Our program is running $40.28 for a single. If you go to Delta Dental's individual policy, it's $60.70. So there's quite a difference there. We do have 3 different plan options. One is a mainly preventative plan. One will pay up to $1,000 per year, and then one that will pay up to $2,000 per year for dental benefits. And it's Delta Dental. It has a lot of dentists in their network, and it is a group plan, so it is reasonably priced.
Good to know. Yeah. And then to the other fun one, vision coverage for those who may need vision coverage.
So yeah, on the vision, we have the same group product, but there we only have one plan. It pays up to $130 for frames or contact lenses a year. So that's every year, where some of them will only pay up to frames every 2 years. This one is that every year. It is a $10 copay exam for, just the actual exam. And then they have different lens copays. So you got trifocals, it'd be a $25 copay for trifocal lenses. So it really helps mitigate the cost of the vision coverage that you need. And these are quite a bit cheaper also. For a single, it's $884, where on the individual side right now it's $17.42 on the individual for the same identical coverage. And with these plans, you can enroll at any time. There is no open enrollment on these. The only downside is if you do leave the plan, you have to leave and pick up other coverage. Otherwise, there could be a 24-month waiting period to come back onto the plan.
Gotcha. To prevent people from going off and on when they need things.
Yeah,
Okay. Exactly.
Perfect. Sometimes it's helpful to understand the why or the intended why behind things, where otherwise it just seems like a bunch of rules that are hard to understand. But that does make sense when you look at it from the insurer's perspective. And then life insurance. Can you touch a little bit on life insurance?
Yeah. Right now we have life insurance through Cincinnati Life. It is simplified issues, so they will ask health questions. They will go up to 100,000 on the limit wise for term life, or they will do I think 25,000 for whole life and 50,000 for return of premium.
Okay.
So those are guaranteed rates. We have the rate sheet, so all we need is ages, and we can kind of get those out to you on that.
Yeah, because that's a nice option. Some people, do have problems getting, even if they don't have real major health problems, but have some minor like diabetes, where they might have trouble getting life insurance.
Okay, yeah, that's really helpful to know. And well, we've kind of had a good scope of all different types of insurance coverages here and related to our health. Is there anything that you can think of that would be helpful for Realtor members to know going into this period? And I know they can always reach out to you for questions. And there's some helpful links to online that we can put in the comments as well. But anything else that you'd like to kind of share with us that would be important for them to know?
Well, I think one thing with the individual policy, I think a lot of people think you have to be really low income to get any tax assistance, and that's really not the case. I worked up somebody the other day, age 60, and if they made, and don't quote me on this, but I'm thinking if they made $100,000 after business expenses, they got like $230 tax credit that could help lower their monthly premium. So you don't have to be, destitute to get this is an IRS program to help make insurance more affordable. So I think a lot of people have the misconception that you have to be really low income to get any help with that.
Yeah, or even a family of four, as you're adding members to that plan, that income can be even less. So we're looking at family fours about making 150,000, still getting $200 to $300 in tax subsidies a month, in their late 30s, early 40s. So yeah, it's kind of for everyone. It's just kind of, we got to look to see if it's for you.
Yeah, everyone's situation is different, and you guys are the experts. So thank you for helping to break down kind of the basic level options that might be available. But if someone is looking for more information or to get started with enrollment, how can they reach out to you?
I think the best way is to give us a call, because as you can tell, can be complicated. And so the best thing is just to give us a call at 1-800-798-6772. And we are on the Realtors website under member benefits listed as well.
Yeah. Thank you so much. And I know you mentioned before you went on live that you kind of specialize in self-employed business owners and Realtor members. So you'll be a great resource if anyone has any questions. And thank you for your time this morning. It's been helpful to kind of start our week off with the task of considering or reconsidering what your health insurance options are. It's not a fun task, but it is important for you and your health and your business. So is there anything else that you'd like to share with the group, or should we get on with our Monday mornings?
The only other thing is, we're here to help educate members. So if you just have a basic question about your current insurance, don't hesitate. Feel free to call us.
Yeah.
We're here to also help educate and, make your guys' lives easier as realtors to kind of figure out what's the best need for you. So
Yeah.
Even if we're not trying to sell it, we're here to educate and kind of
Thank you so much for saying that and for providing that resource for us. It's really helpful because it is confusing, and we need experts like you to help us out sometimes too. Shelly, we will post their contact information in the comments for sure. A link to the website, and then I think Laura just gave the phone number as well. But thank you for tuning in. We don't have any questions coming in, just positive feedback for the information that you shared this morning. So thank you for joining us. And hope that you have a great rest of your week, and we'll definitely be in touch with all of the insurance questions.
Okay. Thank you.
Yes, have a